Also, the governor says he wants Ohio to lead the country in finding better ways to treat mental health. Our senior health correspondent, Monica Robbins, explains.
We must do more. We must not accept that mental illness and addiction are inevitable, or that some of these illnesses can't be prevented.
Governor Mike DeWine began his first term in the midst of the opioid epidemic. He's well aware of how addiction and then mental health fallout from the pandemic impacts Ohioans. Now he wants the legislature to do more.
Building a community care system that increases prevention efforts. 2, offering better crisis response services and treatment options. 3, growing our behavioral health workforce.
He wants resources beefed up.
Expansion of the crisis care system and the new 988 hotline so fewer Ohioans end up in the emergency room.
Better access to mental health care providers for all Ohioans.
Treatment and counseling services delivered either in person or through telehealth visits to people directly in their homes and in their workplace. Suicide prevention to end the needless loss of our brothers and our sisters. Support for our youngest Ohioans so they can have a great start to life and get help at the earliest sign of a behavioral health need.
But that will require boosting the pediatric mental health workforce. There's a plan for that, too.
We're proposing a one-time investment to expand the capacity of our pediatric behavioral health care system to address the shortage of behavioral health professionals serving children.
He wants better access to mental health centers to alleviate the burden elsewhere.
And increased access to state hospitals and private psychiatric hospitals to ease stress on families, emergency departments, courts, and jails.
And he's also asking the General Assembly to create the State of Ohio Action for Resiliency Network, or SOAR. It would be the first of its kind comprehensive multi-year research study that includes Ohioans from every region. The hope is to learn more and later launch new discoveries about the brain and resilience. It would also help understand why mental health issues differ in urban, suburban, rural, and Appalachian communities, because one treatment doesn't always fit all. Now we're going to have to wait and see how this plan and if this plan becomes a reality from the General Assembly.
Quite a wide-ranging speech from the governor today. He also talked about daycare. He wants to improve that. More on that tonight at 11 o'clock. Monica, thank you.
Sure.